Good afternoon, Director Gunachalaka, ADCP here. ASIO investigation, medical issues, medical evaluations, medical standards and safeguards to protect health treatments with the South African military phone with the LRAD, LRAD. ASIO investigation, LRAD mental health. Who are the authorised providers that provide services for LRAD victims? Part 2, we're taking them in. ASIO have ascertained it's a failed adaptive rehabilitation program is designed to improve the quality of life for everyone. Include Disability Insurance Scheme NDIS. ASIO have ascertained it's a failed active lifestyle for a lifetime of health and well-being. ASIO have ascertained they have been charged with failing ASIO investigations. Medical issues, medical evaluations, medical standards and safeguards to protect health treatments with the South African military phone. MI direct ASIO to present findings. UR 532 Medical Program, Part 1, we require them out there. ASIO allege they're killing the people that do the work, and there's a lot of work. ASIO allege is far-reaching. MI direct operations to present findings. Part 2, ASIO ascertained they stated I should be discharged from ASIO. ASIO ascertained they stated I was mentally ill. Question, what were the new findings plus evidence? Question, what have they been charged with? Question, list allegations. Question, what have they stated about HAR? Itemised, they made out it would ease my work burden. 2, there was too much work to go through. 3, it helps them say it's not true, not happening. MI direct operations to take them up. ASIO has ascertained 100% of patients were dissatisfied as per P454. ASIO have ascertained they failed to disclose HAR was undercover ASIO. ASIO have ascertained they failed to amend HAR's medical record, 2017 false record. ASIO alleged they requested his record 2009 to amend was denied FOI. ASIO have ascertained HAR was to say it's not happening in order to be discharged. ASIO have ascertained the medication is not safe. MI direct ASIO to present findings. Part 3, what issues are caused by failing to disclose HAR is undercover? List. List what issues are caused by failing to disclose HAR is undercover. UR 532. Question, who does it affect? Identify. Question, who is doing this work? List. MI direct ASIO to determine what the connection is between ASIO work and being discharged from the PEC. Part 4, what is the evidence that establishes the mental health condition? Question, why was HAR discharged from the PEC? Itemise each instance. HAR had to state it's not happening. Question, why was he admitted? Itemise each instance. What happened in the review process? MI direct ASIO to present findings. Part 2, UR 781 Part 2, Megaray Sonic Weapon and how is Sonic Unit LRAD Medicine Health LRAD Services. The FBI alleged mental health services covers the use of secure LRAD video conferencing to provide medically necessary services. You connect securely with the operator using a computer or smartphone. The FBI alleged LRAD Health Medicare covers certain LRAD health services. Your costs in original Medicare. You pay 20% of the Medicare approved amount to your doctor or the other healthcare provider services, and the Part B deductible applies. Now, due to the public health emergency, doctors and other healthcare providers can use LRAD health services to treat Megaray Sonic device and Howie Sonic Unit LRAD services and for other medically reasonable purposes from offices, hospitals and places of residence like homes, nursing homes and assisted living facilities. As of March 6, 2020, coin insurance and deductibles apply. If you have coverage through a Medicare, you won't have to pay out-of-pocket costs called cost sharing for Megaray Sonic device and Howie Sonic Unit. Note, to find out how much your test item or service will cost, talk to your doctor or healthcare provider. The specific amount you'll owe may depend on several things like other insurance you may have, how much your doctor charges, whether your doctor accepts assignment, the type of facility. Where you get your test item or service, what it is. Medicare LRAD health services includes office visits, psychotherapy consultations and certain other medical and health services that are provided by an eligible provider who isn't at your location using an interactive two-way telecommunication systems like real-time audio and video. These services are available in rural areas under certain conditions, but only if you're located at one of these places: a doctor's office, a hospital, a critical access hospital, CAH, a rural health clinic, a federally qualified health centre, a hospital-based dialysis facility, a skilled nursing facility, a community mental health centre. Note, Medicare made these changes to LRAD Health in 2019. You can get Medicare LRAD health services at renal dialysis facilities and at home, although you must have an in-person visit once a month for the first 3 months and every 3 months thereafter. You can get Medicare LRAD health services for faster diagnosis, evaluation or treatment of symptoms of acute stroke no matter where you are located. If you're being treated for a substance use disorder or a co-occurring mental health disorder, you can get Medicare LRAD health services from home. The FBI allege this includes for certain click to close to be medically necessary means it's appropriate, reasonable and adequate for your condition. Office visits, preventative health screenings, LRAD mental health services. As part of the LRAD medicine benefit, your regional contractor has established a network of providers who can evaluate, treat and refer you as necessary. Referrals and authorizations. As with any behavioural health care received from a mental health network provider, active duty service members would need a referral before getting care under the LRAD mental health care benefit. Mental health active duty family members and retirees do not need a referral or authorization to set an online care appointment with a poor provider. The FBI alleged to request LRAD mental health services. The FBI direct the federal police to identify Louisa Haddad's LRAD harassment victims to the My Health record. The FBI direct the ADF to identify SAS corporals LRAD harassment victims' My Health record. LRAD mental health services include psychotherapy, psychiatric diagnostic interviews and exams and medication management, services for end-stage renal disease. The FBI alleged using LRAD mental health services. Not all providers offer LRAD medicine services. Ask your provider, because it's true in rural areas. It coincides with Omega-Ray, the renal disease in rural areas. They Omega-Rayed 150,000 people. It's all been taken down now. The FBI alleged using LRAD mental health services. Not all providers offer LRAD medicine services. Ask your provider to put Omega-Ray sonic weapon and our sonic unit harassment on your My Health record. You may first need an authorization or referral from your provider to do the following. Call us, find the right phone number for what you need, log in for secure services, find the right place to log in for secure services like enrolling, making appointments or checking referrals, find a claims address, find the right address for medical, pharmacy or dental claims, search the FAQs, find instant answers to most frequently asked questions, ask a benefit question, send us your questions via email, we'll reply within 30 business days, file a complaint, learn how to file a complaint if you don't agree with the decision made about your benefit, your healthcare, MHS nursing advice line, download a mobile app, technical health, mental health centres, find a beneficiary counselling and assistance coordinator or debt collection assistance officer, find a military hospital or clinic. The FBI alleged duty service members need a referral for LRAD mental health care. LRAD medicine services include LRAD medicine, Omega-Ray only conferencing, LRAD Howie Sonic Unit phone calls, Howie Sonic Unit projection. The FBI alleged applied behaviour analysis doesn't include LRAD medicine services, except for completion of outcome measures, referrals and authorization. The FBI direct operations for active duty service members. So there's no medication for the LRAD except for completion of outcome measures. UR 781, you need a referral from your primary care manager PCM for any care he or she doesn't provide. This includes urgent, routine, preventative and specialty care services. Your PCM works with your regional contractor for the referral and authorization. Your contractor will try to refer you to a military hospital or clinic first. If not available, you're referred to a network provider in your region. The FBI have ascertained you can't get any care without seeing your PCM first. If you do, you may be responsible to pay for the out-of-care pocket. Enrolled in mental health programs in remote areas. Your general practitioner. PCM. Megas people enrolled CBD non-whites. Elsa Bendix and Louisa Haddad. The FBI Director of Operations for all other beneficiaries enrolled in a mental health plan. Your PCM gives you a referral for most services that he or she can't provide. Your PCM works, they're the Omega-Ray people, Louisa and Elsa, the Omega-Ray team leaders. Your PCM works with your regional contractor for the referral and authorization. Your contractor will try and refer you to a military hospital clinic first. If not available, be referred to a network provider in your region. If you see a specialist without a referral from your PCM, enrolled in mental health programs in remote areas, work with MEGA's people, MEGA's regional contractor, Louisa Haddad and Elsa Benny Dixon having an assigned PCM, enrolled private health cover, enrolled CBD, non-whites. You'll get a referral to an ASIO specialist, the also Ben Dixon. So that means they put Meagher's people, puts his own people on medication. They put all the National Party on medication in the country areas and the non-whites on medication in the CBD, the Meagher people. You get a referral to an ASIO specialist, also Ben Dixon, and Louisa Haddad with your designated provider. The FBI, they put all the country people on medication, is Meagher. The FBI direct operations for all other beneficiaries. You need a referral for any type of care, except applied behavioural analysis. Other services, yeah, it's tailored for each area. It's tailored for areas. So in Newcastle, they put all the Aussies on it. In Sydney's West, they put all the ethnic people on it. It's tailored differently in each area. Other services may require, in the country areas, they put all the National Party country people on the medication with the LRAD. In the CBDs, it's the non-whites. Need urgent care, learn more. And in country areas, they complain about the country music. They complain about the country music. In the CBD, they complain about the rap music. For the disc jockeys, they complain about the techno. Other services may require prior authorisation. Need urgent care, learn more. No, network versus non-network providers. You should try to see network providers instead of non-network providers. Network providers can't ask you to sign a document to make you pay for authorised services. Ask you to sign a document to make you pay for any part of the service mental health doesn't cover. Refuse to see you because you won't sign such a document. What is a right of refusal? This is when your regional contractor refers you to a military hospital or clinic first. The military facility has the right to take the referral or refuse it. If they refuse it, then you'll get a referral from a network provider. Note, the FBI alleged a mental health care demonstration. The mental health care comprehensive mental health care demonstration covers applied behavioural analysis, ABA, services for Director Aguntulaka mental health beneficiaries diagnosed with conducting Australian signals intelligence. Diagnosed with doing this work. Australian Signals Directorate AS, diagnosed with Australian Signals Directorate ASD. The demonstration began July 25th, 2014 and will continue through to December 1st, 2023. How it works. Getting care through the demo is a 3-step process. Get diagnosed, get a referral and authorisation, schedule an appointment. UR 788. The IHW released 2 other reports on ex-serving ADF members related to medications dispensed and the use of homelessness services in 2017-18. Key findings from the report includes more than 1 million medications were dispensed to around 70,000 contemporary ex-serving ADF members. Around 2/3, 64% of all contemporary ex-serving ADF members were dispensed at least one medication. 20% of contemporary ex-serving ADF members and 15% of all Australians were dispensed antidepressants adjusted for age and sex differences. Ex-serving ADF members' use of homelessness services was lower than the Australian population, 1.1% compared with 3.4%. Male ex-serving ADF specialist homelessness service, SHS, clients required and used more accommodation services compared with ex-serving women. More than half, 53% of female ex-serving ADF SHS clients also needed domestic and family violence services. This reflects the association between the use of domestic and family violence services and the use of homelessness services found among female Australian SHS clients.